joining me an ABC News contributor and infectious disease specialist, Dr. Todd Ellerin, for more on this now. Dr. Ellerin, I want to start with what Kaylee just left off on over there at Dodger Stadium. That's just one example. By the CDC's numbers, we have roughly 20 million unused doses in this country, and yet you've got Dodger Stadium in LA, one of the hardest hit areas in the country, saying they're going to run out. What's going wrong here?
Good morning, Diane. Yeah, I mean, this is a major issue. We're trying to get more vaccine, distribute more vaccine, and then close that administration gap. I mean, I do think that President Biden's plan is a bold one. I think it is doable. The parts, I think of the mnemonic peace. The P is production. The I is investment in people, in supply chain, in more clinics. The E is expansion. Expand those priority groups like we've already heard of. The C is communication. We have to provide that singular message, and the E is education. We want to really try to tackle those that are vaccine hesitant to try to answer their questions so we get more uptake.
I mean, so far, it just seems like there are a lot of things that are falling through the cracks. Hopefully they can fix that. But the death
I think
toll,
we're going to get better.
All right, we hope so. But on a grim note, unfortunately, the death toll in the U.S. right now is on track to top 400,000 in the next few days. What does that number mean to you as someone who works on the front lines of this?
Diane, when I walked through our intensive care unit like I just did before I sat down, I remember that it took 4 months from the first death in the United States to reach that grim 100,000 person death. In this January, this month, we will likely see 100,000 deaths in a single month. Remember, the U.S., for every 4 deaths around the world, 1 is from the United States. That is a staggering number.
It sure is. The good news is, though, it sounds like we're finally seeing a decrease in daily cases in the U.S. and the same for the 7-day averages for tests, cases, hospitalizations, and deaths. So what do you think? Are we finally making progress in flattening the curve?
I think it's too early to tell, Diane. I want to give you better news, but, you know, remember something. I don't even think we've seen the peak number of deaths from the New Year's Eve celebration. That's probably going to be over the next week. What I'm seeing is we're being hit by tidal waves, and what you just reported, yes, it's good news, but it's still a large wave. It's still winter. The virus loves to spread indoors. We have pandemic exhaustion. We're hearing about more variants that are more contagious. I'm afraid that the darkest days are not over yet.
And California health officials have called for pausing distribution of a particular lot of Moderna's vaccine over concerns of allergic reactions. One clinic reported up to 10 reactions within 24 hours. How concerned should we be about that?
Well, I think it's concerning. It also shows that we're not going to endanger people. If we see something that's an issue, we're going to pause and we're going to say, okay, let's not use that lot yet, which, by the way, there were over 300,000 shots from that lot. So we're going to pause there. We're going to see what's going on. But a cluster of 10 in a small number of patients, that's a lot. Remember, the risk of allergy or severe allergy is supposed to be around 1 in 100,000. So I think this needs to be investigated further, and I think we should pause injections from that specific lot.
All right, Dr. Ellerin, thank you as always.
Take care, Diane.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.